Today I had some chest pain, so I'm waiting for a chest x-ray.
Yep, that was me laying on a hospital gurney. I thought I was having a heart attack. I had chest pains before, and that was related to my anxiety. But this one was a little bit different than the other ones that I've had. And the one thing that was different was that the pain was coming through my throat and onto my chin, which was a new symptom for me. And it scared me because as an ER nurse, I'm looking and thinking about the past patients I've taken care of. And I know that women present differently in terms of symptoms compared to men when they're having a heart attack. So with the help of my husband, I went to the hospital. And the caveat here is that we're in Thailand right now, so we ended up going to one of the private hospitals. And in this episode, I wanted to go over what the experience was like in a hospital that's you're a foreigner in, as well as the difference between the symptoms that presents when you have a heart attack between men and women. There's a difference. What do they do in order to confirm whether you have a heart attack? They do have to rule out a couple of things to make sure. And I was genuinely wondering if this was a heart attack or just my body reminding me that I'm not invincible. Although I like to think I am, but I know that I'm not. If you go to the hospital and you present with chest pain, you're telling them you're having a chest pain, they take it very seriously because it could mean that you are having a heart attack. And let's get one thing very clear right away. If you have chest pain, you did the right thing by coming to the hospital. Every time, ask any nurse or doctor about this and they'll tell you, take yourself to the hospital or call 911. Because here's the uncomfortable truth. Heart attacks don't always look dramatic, like what you've seen on drama, TV. They don't always come with, people clutching their chest and collapsing like in the movies. That's just not necessarily what happens. Sometimes the symptoms are a little subtle, like the ones I have had, and that is pressure more than pain, as if something really big was sitting on your chest. It could also feel like squeezing or tightness. And some people say they feel kind of burning sensation. And others could have or experience shortness of breath. And in women, a lot of times, the only one symptom they have is this nausea or just something that feels off. And that's when your intuition kicks in and you want to get things checked out. And as a nurse, I know this. As a human, I tend to second guess myself, and I know a lot of other people do. One of the most common things people ask is, well, how do we know it's not just an anxiety attack? Well, here's the answer, and that's you don't. Not at home. You have to get some diagnostics done in order to figure that out or rule out anxiety. Because chest pain from anxiety, reflux, muscle strain, or panic can feel exactly like a heart attack. And that's why when you go to the hospital, the ER, they don't rely on vibes. They rely on protocols that have been developed over the years from research. So these are proven protocols that can save your life. When you come in with chest pain, the hospital moves fast. Even if it feels slow from the gurney, but from the ER perspective, we are on top of it. And here's what they're looking for. And if you've had a potential heart attack, you might know these tests that they ran. First thing they do is an EKG, and this happens pretty early, and sometimes within minutes. As an ER nurse, sometimes I work in the triage section, and when someone presents with a questionable heart attack symptom, we slap on the EKG right then and there and present that to our ER doctor and make sure it's not an active STEMI because they would be moving up in that triage. If you had an EKG, it looks at the electrical activity of your heart and it checks for signs of an acute heart attack, as if you basically having a heart attack at that moment. So one thing that's important to note, you could have a normal EKG and that doesn't rule out a heart attack because it may not show up in an EKG. It just tells us whether one is happening right at that moment. Another important test that they do, blood test, it's called troponin, and this was also done when I went to the hospital. And this is a big one. It kind of gives you an active and historical picture of your heart condition. So troponin is a protein released when a heart muscle is injured, when you're possibly having a heart attack. And if it's elevated, especially over time, and it's rising, that's a huge flag for the doctors. If you've had this done before, this explains why they repeat the blood test every few hours. So they're watching the trend, not just one number at that moment. They want to see whether the troponin level is going up or is it going down. So if you're in the hospital and you're thinking, why is it taking so long? You want to kind of get the complete picture of what's going on in your heart. And then you ask, well, what about the chest x-ray? When you go to the hospital, they're trying to rule out other things that may show up as chest pain. A couple of things that chest x-ray helps rule out. Pneumonia, that's when your lungs filled up with fluid or an infection. You could also have some kind of lung collapse or a fluid overload, especially if you have any cardiac disease. Also, it could be some certain structural issues with the lungs, with the heart, with anything around your chest or in your chest. And let's look at men versus women heart attacks because they can differ widely. And this is especially for women out there. Most of the research that was done in the past were done with men. So it's important to note some of the special symptoms that women present. Men are more likely to report crushing chest pain. And I've experienced and seen patients come in with this type of pain, and it's typically men. And pressure radiating down the left arm. This is my left arm. And women are more likely to experience shortness of breath. And I have to tell you, when I was working in the ER, the women who present with cardiac arrest or heart attack really presented with symptoms like fatigue, nausea, so they're very subtle. Some back pain, neck pain, and jaw pain. Not necessarily this crushing chest pain that men typically present. Some women also complained of dizziness or just their intuition telling them they're just not feeling right. What's scary is that women are more likely to be dismissed or misdiagnosed, not by the healthcare provider by themselves, but women tend to dismiss their own symptoms, and that's typical. That's not an opinion, that's actually data. If you're a woman and something feels wrong, trust your instincts and advocate for yourself and get whatever you're presenting with or feeling, get it checked out. And a lot of times patients come in and say, well, I'm healthy. I eat, healthy meals. I exercise. Why me? Why do I have a heart attack? And that's a good question. And unfortunately, it could happen to anybody. Just because being active, eating well, doing yoga, CrossFit, Muay Thai, that's all great. I do it too. But they do not make you immune to this type of effect in your body, because there are other risks besides diet and exercise or lack of. And these are other risks such as genetics. You may be predisposed to having heart issues. You may be predisposed to having a high blood pressure. There are some genetic components with high cholesterol. And this is a big one. Stress. Now, raise your hand if you have stress, because I would assume everybody listening to this would have stress. Stress is an important component that we have and hold that's so important, but we don't really recognize it. And it's important to know what your stressors are and to minimize those factors, those stressors. And if exercising helps you reduce your stress, then exercise. And that's what I do. I exercise practically every morning because I tend to hold on to my stress throughout the day. And when I exercise, it tends to help me balance these stressors throughout the day, and it makes me feel less stressed. Another risk factor is inflammation. And again, inflammation is so hard and it's silent, so you don't really feel it. But inflammation could be tied to your stress. It could be tied to what you eat. It could be tied to a disease process that you're not even aware of. Yearly checkups are important because they will check in your blood work inflammation markers. Anybody gets enough sleep, they recommend at least 8 hours. This is important because if you don't have enough sleep, it can mess with a lot of different physiological things that are happening in your body, especially stress levels. So get enough sleep. I think as I got older, I find sleep really important. But when you're younger and you've got so much to do, you think that, oh, I can go ahead and go without sleep. But that's not the case. Luckily, as we grow older, we get wiser and we put sleep in our top priority. And if it's not there right now, it should be. Recently, we're beginning to understand hormone levels, whether they're too high or too low, can affect our inflammation levels as well as our stress levels. So those are key factors that you may not be aware of, or you may not even be able to control, but just keep that in your mind. Yeah, do your exercise, eat healthy, but remember there are other factors you may or may not have control. So yearly checkup is important to figure these things out. Health isn't about perfection. It's about probability because there are so many things that make up what is health and what can cause disease. So do the best you can. Chest pain is never nothing until proven otherwise. And proven otherwise is with the help of your medical providers. Don't try to rationalize and fix it yourself. Because if you are having an active heart attack in the hospital, they could do slews of tests and interventions that can help save your life. The hospital process can feel slow, but it is deliberate. And this is coming from an ER nurse that took care of patients that were having active heart attack and going through the process to treat them and having them discharged back to what they were. A normal test doesn't always mean you can go home immediately. And that's why doctors want to observe you for maybe a half a day or a full day. And more research is being done for women as well. That's a good thing for us. And you're not wasting anyone's time by getting checked. I think women feel they're guilty, that they can do everything and someone else needs me, so they don't take care of themselves, and it could be detrimental. I hope this video helped a little bit in terms of realizing that your health matters and that if you are having chest pain, that you go to the hospital, whether you are a woman or whether you're a man, or whether you're whatever gender you are that you identify yourself with. And if this video helped at least one person, I think it's worth it to put this message out. And stay tuned in our next video as I go over specifically my experience in the hospital in Thailand, how much it cost, what my diagnosis was, and what happened during the follow-up. Thanks everyone for watching, and stay tuned. Bye-bye.